Hello, it's plank of the day time.
And of course, there can only be one plank. I know you're all expecting it to be one particular individual, and I know that you're all expecting me to have a go. But I've already had a go at that particular individual because I'm now going to do every single day, just after 8 o'clock, just after the news, I'm going to do Mike's Meltdown, which will be me doing a little monologue on the subject of the day. Today, that subject was Peter Mandelson and Keir Starmer, and how dreadful and how embarrassing this whole scandal is, not just for the government, but for everyone in Britain, because people are looking at this country now and laughing, not for the first time, because of course it looks like an absolute shambles. I mean, you can't even have, the supposedly Iron Chancellor, Gordon Brown. You can't have a man like that being shown up to be a complete incompetent nincompoop who didn't know that his own business secretary was giving away financial details of his planned policy before he'd even announced it. How could he not know that? So anyway, he's not the plank of the day. The plank of the day today is the British Medical Association, the BMA. Because guess what? Those nice people, those doctors who are supposed to look after patients, who are supposed to cure people of disease, who are supposed to operate on people who need help, whose health is deteriorating, and they're supposed to save people's lives. But no, they don't want to do that. But what they do want to do is go out on strike yet again. Junior doctors, ladies and gentlemen, the lowest of the low. Not every doctor in a hospital is a member of the BMA, and quite often when the BMA announces another strike, a lot of doctors don't actually go on strike because they've actually got consciences and they've actually got the wherewithal to want to help people. But they call themselves resident doctors now. I don't. I still call them junior doctors. They don't like being called junior doctors because they think it makes them sound like youngsters, people who don't know what they're doing, people who are sort of, learning on the job. And of course, many of them are very senior and many of them are paid very well. But they have had literally 59 days of strikes since 2023, right? When this Labour government got in last July in 2024, actually July before, they gave them an immediate pay rise of about 30%. And over the previous 2 years, including that 30% pay rise, they've had a pay rise of 56%. Imagine if you got an extra 56% of your pay given to you as a pay rise, right? So say you were making £40,000 a year, you'd suddenly be making 60. Say you were making £30 a year, you'd suddenly be making 45. Then that would be quite a big help to you, wouldn't it? But not to these people, because they want to be able to go on strike yet again. And they voted by 93% in a ballot that basically they should be able to go on strike again in the next 6 months. So they're going to create more headaches for the NHS, more backlogs for the NHS. The last time they went on strike, and every time before that, the strike ended up costing millions and millions of operations, millions and millions, hundreds of millions of pounds, and they don't care. They don't mind that they put the NHS under more pressure. They don't mind that people's operations get cancelled. They don't care that people die as a result, and many people have. All they care about is getting more money for doing less work, right? And believe it or not, something like just 50% of the members of the BMA voted for this. So 50% of them didn't even bother voting. And there are many doctors, as I say, who are not even in the BMA. So the government is in the process of passing emergency legislation to give British doctors priority for NHS jobs over foreigners, which is what the BMA wants. So they're already doing that. That could be halted if strike dates are announced. The BMA has a mandate to keep calling strikes until August the 2nd. And if you remember, the last time they walked out, it was for 5 days just before Christmas. Really good timing. Really nice of them, isn't it? I'm sick to death of these doctors. And as I said before, if it was down to me, the people who voted to go on strike, I would just get rid of them. And people said, are you mad? That would cripple the NHS. Really? Well, these people seem absolutely convinced that that's their job. They say they want to cripple the NHS. Dr. Jack Fletcher, who's chair of the BMA's Resident Doctors Committee, right, or Junior Doctors Committee, said this: the government's got no choice but to get a deal. And if there's a timely settlement with more money, they won't go on strike. Well, that's like holding the government to ransom, isn't it? Every round of strike action costs the NHS about £250 million. And NHS waiting lists stand at 7.4 million. We found out just yesterday, didn't we? that what I've been saying for ages and ages turns out to be true. Waiting lists are not going down. They were not reduced by 86,000 a couple of months ago, as Keir Starmer said, and they certainly were not reduced as a result of more people being seen by the NHS. They were reduced because NHS hospitals have been paid millions of pounds a month just to get rid of some names. That's how they run the NHS these days. It's an absolute shambles. So the BMA, plank of the day.
Hello, it's plank of the day time.